Hello everyone, I'm Dr. Aman Kapoor, your host, welcoming you to the first episode of the podcast series Healthy Heart with Dr. Rohit Sane. Dr. Rohit Sane is the founder of Madhavbaug, India's leading heart disease reversal expert. Dr. Rohit Sane has more than 150 research papers published to his name and has helped more than 10 lakh patients reverse heart disease, diabetes, and other lifestyle diseases. This series is an initiative of Dr. Rohit Sane where he'll be giving you vital tips and guidance that will help you protect your heart from heart attack and other heart diseases, and also give you tips and guidance that will give you an knowledge to live a healthy life lifelong. In this episode, we are going to discuss about heart attack, how to find out whether you're getting a heart attack. Dr. Sane, welcome sir. Let's start with the first question. How to know if you are having a heart attack?
Okay. If you talk about the symptoms of heart attack, there could be n number of symptoms that a patient with heart attack could present. The first symptom that normally people do present is no symptom at all. So the first symptom could be no symptom. There could be n number of silent heart attacks in which the patient doesn't present with any symptom at all. But if at all we have the other group of people, there could be n number of symptoms that the patient could present with. Like, for example, the patient might present with left hand pain. The patient might present with left arm pain. It could be left chest pain. Many a times the pain could be on the right side of the chest also. The pain can be experienced on the back side of the chest also. Many a times the patient presents with choking of the throat also. Many a times the patient presents with a rock-like feeling, a very heavy kind of feeling in the chest. Many a times the pain gets radiated to the jaws also, as well as the patient could present many a times with severe breathlessness in the resting or supine position also, as well as the patient could present pain in the epigastric region, in the stomach region also. There could be n number of presentations that a patient could present with. So instead of these pain kind symptoms and breathlessness kind symptoms, there could be other symptoms also, like a patient could present with severe vomiting kind of symptoms. Many a times the patient could present with something like having no control on his bowel and bladders. Many a times he passes off the stools and urine without any control on it. There could be n number of symptoms that a patient with heart attack could present. So heart attack many a times goes silent also, as well as it presents with n number of such kind of symptoms, and these symptoms are never to be neglected. We need to treat the heart attack as early as possible.
Thank you, Dr. Sane. Now, coming to the second question, you have mentioned in this while answering the first question about silent heart attack. And a lot of people have this doubt. So, what exactly is silent heart attack? Please guide us.
Okay. So first you need to understand what do you mean by a silent heart attack. There could be two fate of heart attack that can happen in this silent heart attack kind of case. Many a times it has been said so that in case of a diabetic individual, in case of an individual with some nervous disorders, these patients normally don't feel the pain to that level. That could be one of the presentation, but there could be other things which researchers have mentioned about, and that is what we are supposed to understand. So many a times silent heart attack goes unrecognized. Many a times when patients come down to us with an ECG done, many a times we do recognize that this patient has suffered a heart attack sometimes in the past. So what does that mean? You need to understand a concept of VO2 max. VO2 max is nothing else but volume of oxygen consumed by the body every minute. So how does it relate to silent heart attack? I'll be very clear about it. Like, consider the normal VO2 max for a patient, for a healthy subject. The normal VO2 max in males should be beyond 35 ml per kg body weight, and in case of females it should be beyond 30 ml per kg body weight. Now, consider I have a healthy VO2 max, and with this healthy VO2 max and I suffer a heart attack today. Due to my healthy VO2 max, my heart will have a huge amount of strength a good amount of military power to fight against an incoming heart attack, and this incoming heart attack would not be able to create any damage to my heart, and this heart attack might be recognized as a silent heart attack after few years of this incidence. But if at all my VO2 max is not 35 in case of males and beyond 30 in case of females, if at all my VO2 max is not that strong, and consider I have a VO2 max somewhere about 20 or 22 or 25, I would feel that kind of pain in my heart, in my chest, and I would present with a non-silent heart attack, and in this case I would need to get admitted into some kind of ICU for the further support for my cardiorespiratory system. So after this I might come back to my home, or else I might suffer a cardiac arrest or some kind of heart failure as my VO2 max was lower. But many a times the researchers also have mentioned that if my VO2 max is not even 20-25 and I have a VO2 max below 12 ml per kg body weight, then that is very bad sign. You need to understand that if at all the VO2 max is below 12 ml per kg body weight and I suffer a heart attack, I will not be able to survive this heart attack. So a silent heart attack would mean that if at all my VO2 max is quite good, beyond 35 in case of males and beyond 30 in case of females, if at all my VO2 max is good, the heart attack, if it's not able to create any kind of problems in my body, then in that case this heart attack would not present with any kind of chest pain like symptoms, and it might be called as a silent heart attack on one side. But on the other side, if at all my heart is weak and my VO2 max is below 12 ml per kg body weight, then I would not even have that much amount of time to recognize this as a heart attack, and my heart would fail on that moment itself. Hence, to understand the concept of silent heart attack, you need to understand the concept of VO2 max, and if you understand the VO2 max and assess your VO2 max, you will be able to fight against an incoming heart attack.
Thank you, Dr. Sane. So, from what I understand, VO2 max, knowing your VO2 max is very important. Now, how do we come to know what our VO2 max is? One, and two, a very important question coming from heart attack and VO2 max discussion is that suppose if one suspects one is getting a heart attack, what should be done as an emergency measure at such a time? So over to you, sir.
Okay. The first question that you asked about how to assess your VO2 max. VO2 max can be assessed on various different devices or medical instruments. The best thing, the easiest thing that you can do is with a simple stress test. If you get a stress test done with a software which can calculate the VO2 max for you, this is going to be the best test that you will be able to identify your cardiopulmonary exercise tolerance test. So this test shows you what kind of tolerance level that you have against an incoming heart attack. So if you have to measure your VO2 max, a simple stress test could be the easiest way that you can address your VO2 max question too. That is first. The second thing, as you mentioned, that if at all a patient seems to have a heart attack, what would be the emergency steps that one should have? The first thing is to call up for a medical help. Call up the ambulance, call up the doctor, whomsoever you want, call up that person and address your chest pain immediately without losing any time, because many a times, even though the pain that you have experienced might be a heart attack, might not be a heart attack, but do not take chances in such kind of cases. That is the first thing. Call up for medical help. The second thing, there are few medicines that you can consume. The best medicine during a heart attack, during the chest pain itself, there is a classical medicine called as ecosprin. This ecosprin medicine can be utilized very well, in which this is nothing else but an antiplatelet agent which is going to stop the blood clot formation within the first 6 hours if at all it has been consumed. So now this ecosprin in a dose of about 375 milligram, if at all it has been consumed, or even though you don't have such a high dose but you have a 150 milligram ecosprin, have it immediately and rush towards a medical center, rush towards the nearest doctor who can help you to survive this is heart attack. So do not take chances. This would be the most minimum thing that you can do if at all you recognize any kind of symptoms or signs of a heart attack.
Dr. Sane, for wonderful guidance around understanding the symptoms of heart attack. What is VO2 max? What is silent heart attack? And most importantly, what to do if one suspects heart attack. My dear friends, thank you for joining in today and connecting with us for such a valuable episode. I'm sure you would have gathered a good insight and would be now better prepared than what you were earlier. This is not the only thing you need to do. You have to share this knowledge with those whom you love and care. So sharing and caring begins by sharing this knowledge. Share this podcast with your friends, family members, relatives, and anybody whom you think can benefit from this. Like, subscribe to this podcast series to stay updated about the upcoming topics. And if you have any question, please do ask in the comment section. With this, I, Dr. Aman Kapoor, take your leave. Till the next episode, stay healthy, stay fit and fine. Bye-bye.